You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
In commemoration of National Health Center Week 2010, AAPCHO brings you this special edition of Voices from the Frontline, Innovations in Workforce Development. Voices from the Frontline is a podcast series dedicated to spotlighting the unique experiences and insights of the dedicated, passionate people at the helm of AAPCHO's member health organizations. In this episode, Communications Assistant Beverly Quintana asks Health Services Coordinator Kamahanahokulani Ferrar about Papa Ola Lokahi's Native Hawaiian Health Scholarship Program, which recruits applicants from rural areas to go into primary healthcare fields.
So we have Kamahana here today to get her insights on the importance of workforce development. Kamahana, can you tell us about the program you direct at Papa Ola Lokahi?
Sure. I primarily work at a scholarship program, so we recruit applicants primarily from rural areas to go into 17 different primary health care fields. And our scholarship provides tuition, fees, books, other related school costs, health insurance, and a monthly stipend. And we have someone who works with the scholars as they are in their education phase. And I begin to work with people a year before they graduate, or before they enter their residency or their postdoctoral work, and transition from being a student to entering the workforce. And then I am responsible to place our scholars in their first position.
What would you say is the goal of that program, and why was it created?
So the purpose of the scholarship program is to provide educational access to Native Hawaiians, to then be able to provide primary health care services to people living in rural areas.
Did you model the program after an existing program, or did you just develop it from scratch?
I believe it was modeled after the National Health Service Corps. However, we are very different in the National Health Service Corps.
So what strengths do you see in your specific program?
I see the fact that we actually provide access to education first to increase the number of Native Hawaiian clinicians. And then our scholarship awards are primarily based on people's desire to serve. So it's not necessarily just about access to funding. It's not just a scholarship so you could get through college. It's education is a means for people who want to work in rural communities to improve the health and serve others. So I think it's different that way. I think also because we have strong partnerships within the community, and we have a component that is culturally based, also makes a difference. And I think when you look at accessibility issues, affordability issues, and access to care, the fact that a provider looks like you, understands the conditions of your family, understands why things are the way they are, then people are less judgmental and more open to being flexible and trying to figure out how to provide the services that families need. And it's also acknowledging that care is not to just one person. It's really to the whole family, which is really to the whole community. And from there, you can have wellness.
That kind of ties into my next question, is your suggestions or recommendations for other organizations, especially community-based organizations, that may want to create similar programs, what your suggestions would be.
From an employer's perspective, I think to look within our communities and who we will continue to support and grow so that our communities can become healthy beyond doctors, beyond health conditions. it's healthy more in the mind, body, spirit, economics, and then you can address a lot of other social issues as well.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.appcho.org and tune in for our next podcast at www.aapcho.org.